Hi, my name's Laird Kagan. In 2005, my wife started developing a number of very unusual illnesses, one after another. She started with a very heavy fever that was quite scary. It was about the October of 2005. She developed 103 fever that lasted almost 10 days. We looked on the website to see if it was scarlet fever or a number of other things, and it just didn't quite match up with anything else, and then suddenly it just disappeared. A few weeks later, she developed an inner ear problem that caused such excruciating pain that she got vertigo. Just standing up, she would pass out, literally, and get nauseous and throw up. It lasted about 3 weeks. We went to an ear, nose, and throat specialist, and he tested her for a sort of a typical inner ear problem, and it just didn't quite fit. And then suddenly, about 3-4 weeks later, that disappeared. After that, she got a number of other really unusual illnesses. She had a shooting pain down her leg that emanated around her hip that lasted about 2 years and then suddenly disappeared. She had doctors trying to figure out what to do. They wanted to give her a hip replacement, a hip hysterectomy, a number of other operations. They thought she might have cancer. She had complete insomnia. Every night at 2:30 in the morning, she would wake up completely wide awake, staring at the ceiling, not able to get back to sleep again. And you can imagine the stress that puts on your body, not being able to sleep. Waking up with kind of like your body's revved up, like an adrenaline rush going on. She had a lung problem. She was only breathing 60% of her normal lung capacity. She had a cough that continued on for months and months and months. She had an expert specialist tester giving her steroids to try to calm down a bacterial infection that could be causing some lung issues. Couldn't quite figure out what it was, couldn't get to the bottom of it, ran test after test. And she saw doctor after doctor. She saw, literally about 50 different doctors. She had grew up in the Midwest and had relatives that grew up on farms, and was aware of Lyme disease. I grew up in New York and wasn't really near the city, so I wasn't really aware of Lyme disease. So she would ask a number of her doctors, could it be Lyme disease? And repeatedly they said, no, there's no Lyme disease in Northern California or in this area. And just, I don't think they dealt with it very much. They didn't know what to do. They didn't test her, and they just dismissed it and wouldn't test her. Finally, about 2011, about 5 years after this, one of her close friends, Lori, who had been diagnosed with Lyme disease, said, you know, Sherry, your symptoms sound a lot like mine. I have a lot of unusual symptoms, and the things that you're experiencing seem very much like my symptoms, and you really should get tested for Lyme disease. So finally, Sherry demanded of her doctor to get tested, had to threaten not to come back. She was in a very difficult, damaged state, a very weak state with lung problems, trouble breathing. She ended up with a MRSA staph infection in the hospital one night and literally almost died from that. They didn't know what was causing her, what it was, finally this doctor checked with a Lyme doctor to find out what to do to test for Lyme disease, sent Sherry in for the test. And there's two different types of tests for Lyme disease. There's what's known as an ELISA or Western blot test that is not very accurate, and it tests for the antibodies in your body. And then there's another kind of test called PCR, preliminary chain reaction test, which amplifies the actual DNA of the bacteria millions and millions of times to give it enough substance to make an actual reading of the Lyme disease. And if you get a positive reading on PCR, it's 100%. You have the Lyme disease. There's quite a few false negatives on PCR because it doesn't. It's very difficult to find it in your bloodstream, and so oftentimes they just miss it, and you may have Lyme disease, but it doesn't show up. In her case, she tested positive in PCR, and so it was a dead ringer for 100% for Lyme. So we started investigating then what to do. So Here we are 5 years later and starting to investigate in the literature, on the internet, talking to doctors, talking to friends, talking to anyone we could to figure out what it is this Lyme disease is about, and what are the symptoms, what are the remedies, what are the cures. And it was a very frustrating situation. There were no good answers. There was controversy about how to treat Lyme. There was dozens and dozens of different advanced, unique treatments going on around the world to test it. There was controversy around almost all of them. I would say that the typical mainstream Western doctors were not familiar with Lyme, certainly not in our area in Northern California, and they didn't know much what to do. On the other hand, there were other doctors that were Lyme-focused doctors, known as Lyme-literate doctors, or who specialize in Lyme, and a few number around the country, and their treatment through practice and trial was geared around extensive long-term treatment on antibiotics. Long-term treatment of antibiotics is not good for you. She chose to go on oral antibiotics and did that for about 4 months, and very quickly got significantly better. Other symptoms that she had her hands started to be difficult to use. She would drop things. Her feet hurt and had a stinging and felt like clubs. They kind of turned in, and just the whole nervous system and immune system started, or nervous system of the body started to not work well. And of course, a classic symptom, she had what we call brain fog, that she had periods where she couldn't remember things, she couldn't remember how to spell words that were simple, and couldn't focus or concentrate on more than one thing at a time. It's a very, very scary situation to be involved in, and to experience as a patient, and certainly also for spouses to experience your loved one to go through that, and for children to not have a fully capable parent on a way that they had been previously. So Sherry opted for the treatment. She went in for 4 months, and as I said, progressed significantly better. And after 3 months being off the antibiotics, was feeling worse than she was when she first started the antibiotics. She talked to people about going on the intravenous antibiotics, and you know, she continued to be scared to do that. But universally, everybody said it's very expensive process. But universally, everyone said if you can afford it, absolutely do it. There's no question. So she'd be on intravenous anywhere from 1.5 to 6 hours a day during this period of time. She found that after the first 4 to 6 weeks of intravenous Rocephin, that for the first time in her treatment, the brain fog was cleared up, and that the oral antibiotics she had taken for the first 4 months were not sufficient and did not break the blood-brain barrier and didn't touch the infection that was going on in her brain. She said it was amazing. It was like the world had cleared up, that she was able to think clearly for the first time in years. And she felt a lot better and did a lot better. A lot of the pains and issues that were in her body had gone away. And she was hopeful that maybe she's done. And typical of Lyme patients, she wasn't done. She tends to do better after each course, but symptoms come back, and then she gets treated. The time on antibiotics tends to shrink. The time to relapse gets longer. She's learning to manage it better, but she still has continued symptoms. One of the biggest challenges about one or sometimes multiple family members contracting Lyme disease is that you don't really look like you have anything wrong with you. You look good. People look fine. They say, "Hey, you look fine." And you know, my wife at parties and going out, she doesn't feel like going out that much, but when we do go out, she can smile and show some energy. People say, "Hey, you look good. You know, how you doing?" And inside, she's in terrible joint pain. She's tired. She's cranky and feels miserable. and that's difficult because you know, for family members, you know, the person just the patient with Lyme just doesn't feel like doing anything, and it's debilitating. And so it's you know, in my situation, Sherry doesn't sleep well at night. She still has problems sleeping well. She can wake up in the middle of the night and go hours just trying to get back to sleep. And so I typically let her sleep in every morning, take care of the kids in the morning, get them to school, get them breakfast. There are times when she just doesn't feel like going out, and need to really cut her some slack to schedule around times when she needs support and help. It is so it's difficult on family members. They don't have the 100% full energy capability of a parent. And when you're a parent, it takes a lot of energy to be working with your children and taking care of their needs, cooking them dinner, driving them around. And so that part's difficult, and that's a part that you need a you know, as a spouse, you need to be compassionate about the challenges, the pain, the grueling antibiotic treatment that goes on with the patient, with your spouse, and it's been a long time. It's now January 2015, and Sherry got bit in 2005. For 5 years before we knew what she had, I thought she was the most unlucky person in health that I had met. And finally, after 5 years, we finally, you know, found out it was Lyme disease. And every one of those symptoms traced back to Lyme disease, every single one. If you or a loved one has been bitten by a tick, or you suspect you have Lyme disease, I would encourage you to take action. I'd encourage you to get tested if you can. And take action. The sooner you take action, the better. Lyme disease unchecked can go on for years and years. The longer it goes untreated, the worse it gets, and the harder it is to get rid of. If you have any questions about Lyme disease, I welcome you to visit our website. We have people that are on staff to help you deal with these issues. And thanks for hearing my story. I wish you the best.